everyone, my name is Brianna and welcome back to How Do We Function. This is episode 3 and we have Dr. Holick with us today. How are you doing?
I'm doing great, Brianna. How about yourself?
I'm doing well, thank you. Before we begin, I just wanted to ask you to introduce yourself to us for a little bit.
Sure. So, I'm Michael Holick. I'm professor of medicine, physiology, and biophysics, director of the Bone Healthcare Clinic, director of the Vitamin D Skin and Bone Research Laboratory, and director of the Ehlers-Danlos Clinical Research Study here at Boston University Medical Center.
Awesome. Well, as you said, you deal with vitamin D, and I think the first biggest question is, what is vitamin D and how does it work inside of our bodies?
Right. So vitamin D is, of course, a sunshine vitamin. It's a fat-soluble vitamin, and its major function is to make sure your blood calcium remains normal, and that's good for bone health. But we're now beginning to recognize that there are many other issues associated with vitamin D deficiency. So we think that vitamin D plays a very important role in overall health and welfare.
Awesome. Well, when it comes to vitamin D, if we don't have enough of it in our bodies, what tends to happen?
Right. So for sure, if you're vitamin D deficient, in children it causes rickets, and in adults it causes a painful bone disease known as osteomalacia, where patients can have aches and pains in their bones and muscles. It also can precipitate and exacerbate osteoporosis. But separately, we're now recognizing that your immune system needs vitamin D, and that vitamin D plays a critical role in modulating your immune system. And we think that may be important for fighting infectious diseases, even upper respiratory tract infections, tuberculosis, as well as reducing risk for many autoimmune diseases like multiple sclerosis, type 1 diabetes, and Crohn's disease, reduces risk for many deadly cancers, improves neurocognitive function, reduces risk of type 2 diabetes and heart disease, and basically the list goes on. Every tissue and cell in your body has a vitamin D receptor, and therefore we think vitamin D plays a very important role in overall health and welfare.
Well, vitamin D plays a very important role. Is there an adverse effect if you have too much vitamin D?
No question about it, but you have to take literally hundreds of thousands of units of vitamin D a day for at least months to a year before you have to even begin to worry about vitamin D toxicity. What it'll do is it increases your blood calcium and blood phosphate, and therefore increases risk for high blood calcium and phosphate, which can calcify your kidneys and your blood vessels, and ultimately can lead to death. So vitamin D intoxication can be very serious, but it's one of the least common medical conditions in the world.
Mm-hmm.
And typically it's when you're taking excessive amounts. We're talking about like 1 million units a day for like a half a year, is that when you begin to worry about vitamin D toxicity.
Okay. Well, as you know, we have red skin syndrome, and you talked about vitamin D with autoimmune disorders. What specifically does vitamin D do for skin health?
Right. So we know that when you're exposed to sunlight, you make vitamin D in your skin, and we think that vitamin D may have an important role in your overall skin health. There's no absolute good evidence for that, but there is some mounting evidence to suggest that it can help maintain the thickness of your epidermis and keep your dermis healthier. And there is also some evidence now that when you're exposed to sunlight and making vitamin D, that the sunlight-induced damage to your DNA is reversed, probably by a variety of mechanisms, and maybe also by vitamin D.
Awesome. My last question is, when it comes to supplementation, what would you recommend if someone is deficient with vitamin D?
Right, so as you probably are aware, vitamin D is a sunshine vitamin, so we do recommend some sensible sun exposure. And the problem, of course, is time of day, season, latitude, degree of skin pigmentation. So how are you to know? Well, the best way to know is to use an app that we developed called DMinder.info. So DMinder.info.
Okay.
It'll tell you anywhere on this planet any time of the day, whether you can or can't make vitamin D. It'll tell you how much vitamin D you make, and it'll tell you when to get out of the sun so you don't get a sunburn. So my recommendation is always sensible sun exposure, followed by good sun protection, and always protect your face. Never need to have it exposed to sunlight. In terms of vitamin D supplementation, the recommendation for infants, especially breastfed infants, but all infants should be getting 400 units of vitamin D a day. An easy way for mothers that are breastfeeding to get their infant vitamin D is just to put a vitamin D drop on her nipple, and then as the infant suckling can get the vitamin D, so it's a real simple way. For children who may not want to be taking supplements, they have gummy bears out there and all types of ways of increasing their vitamin D intake. And of course, the vitamin D drops, again, to put a few drops in some milk or orange juice will be able to improve their vitamin D status. 600 to 1,000 units a day for children. And I think that teenagers should be like adults. Minimum should be 1,500 to 2,000 units of vitamin D a day. And I recommend for all of my adult patients 3,000 units of vitamin D a day. I personally take 4,000 every day. My blood level for 25-hydroxyvitamin D is in the range of about 50 to 60 nanograms per ml, which I think is an ideal range to be in. Also, if you're obese, you need 2 to 3 times more because vitamin D is fat soluble and it gets diluted in your body fat. And so, as a result, obese people, if they take just a routine amount of vitamin D, are at much higher risk for vitamin D deficiency and the chronic illnesses associated with that disorder.
Well, thank you. Is there any perhaps food that has a good source of vitamin D, or?
So herein lies the problem. Mother Nature designed us, I think, a long time ago, that if you needed something absolutely positively, why not get it from the sun? Because our hunter-gatherer forefathers were exposed every day. A study was done in Maasai herders showing that even though they live at the equator, exposed to sunlight all the time, no increased risk for skin cancer, they're still able to make enough vitamin D. Their blood levels, 40 to 50 nanograms per ml. It's equivalent to them making about 4,000 to 5,000 international units of vitamin D every day. So what are the foods? So milk contains in an 8-ounce glass 100 units. Well, that's okay. It's a little bit more vitamin D. Farm salmon contain very little vitamin D compared to wild-caught salmon. Wild-caught salmon contain about 500 to 1,000 units, 3.5 ounces, about 1 serving of salmon. Mushrooms exposed to sunlight make vitamin D, so it can be a source of vitamin D, and cod liver oil. And orange juice that contains vitamin D, it's 100 units in a serving, just like with milk. So the major sources really are mushrooms exposed to sunlight, cod liver oil, and wild-caught salmon. And herein lies the problem. And that's why most people are vitamin D deficient or insufficient. You can't get it from a healthy diet. You definitely need it from sensible sun exposure, and I always recommend for everyone, increase your vitamin D status to guarantee it by taking a vitamin D supplement as I recommended.
Awesome. Well, I live in the Sunshine State, so I can just go outside for a little while and I should be fine.
Maybe. So you use the app, because for example, you think that if you live in a Sunshine State like Florida, that you can go out at 8 o'clock in the morning, go jogging, make your vitamin D. You make no vitamin D. So it's between 10 a.m. and 3 p.m. is the times that you make vitamin D in your skin. Before that, very little, if any. And then if you live like here, above Atlanta, Georgia, right, you basically cannot make any vitamin D in your skin at any time of the day from about November until March.
Wow. Well, I'll definitely put your app in a link so everyone can have it. But before we conclude, is there anything else that you would like to say, suggest, any advice?
Well, I think the bottom line is simple. There is no downside to increasing your vitamin D intake. And I do urge people to take a vitamin D supplement. Unless you're a lifeguard or a Maasai herder outside every day, you can't get enough vitamin D from sun exposure. And in fact, we did a study and looked at over 3.8 million samples throughout the entire United States. And we showed that that average change in blood level is about 8 to 10 nanograms per ml between the end of the winter and the end of the summer. So to get your vitamin D, to satisfy your vitamin D requirement, sensible sun exposure along with vitamin D supplementation.
Thank you so much for sharing all of your knowledge about this. We really appreciate it. And everyone, this is Dr. Holick. I'll put whatever links he has up for you to follow him, read up on any of his research and things like that. So thank you so much for speaking with us.
Have a delightful day and go to drholick.com, just drholick.com. Have a good day.
Thank you. You too.
Bye-bye.